Question?
Well, one is worth mentioning is a 3-shot series, so you're talking about $450 total.
Exactly, yeah. So 3 shots, you gotta multiply it out plus whatever the cost is to see your provider.
Is there any reason or any known benefit to actually getting both vaccines, or if someone's gotten one and they're just about to take the other one, or because the immune response is better? I assume you can get them separately if you really wanted to?
You could get them separately if you wanted to. If you had the kind that protects against 4 strains, it's not necessarily going to be super beneficial to get the kind that protects against 2 immediately after. If you were, say, maybe 10 years out and you wanted a booster and maybe you got that instead of getting the other series again, that could be a benefit to you. But if you've had the one that only protects against 2 strains and then you want to go back and get the one that protects against 4, then you'd be getting some extra benefit on top.
Is there any test you can take to see whether the response is still there, or any recommendations about how long you want, or how often you want to get a booster, or anything?
They're saying probably 10 years for boosters. Probably, but because the vaccine is so new, it was only released in 2006, no one is at the point yet where they would need a booster. There will probably be studies among people who had gotten the HPV vaccine when it first came out, so in 8 to 10 years they might start recruiting people to start doing a study where they figure out if they need boosters or not. But as of right now, people are saying probably 10 years, maybe longer. In terms of the tests that they do in these studies, they do have tests where they can draw your blood and figure out what your immune response is to it. I do not know of those being commercially available to people outside of a research setting.
Do you know if Family Packs or Minor Consent Medi-Cal covers these vaccines?
Minor Consent Medi-Cal does cover it.
Even for men?
Probably not for men.
Okay.
And Family Pack does not cover it. So Family Pack is the family planning branch of Medi-Cal. So it only covers things like birth control, STD, testing and treatment. They have said themselves on a conference call that I was on that if they covered the HPV vaccine, they would go bankrupt. So Family Pack is never going to cover this. Another thing that's worth noting, I do know that Merck has a patient assistance program. So if you happen to be someone who is eligible for certain Medi-Cal services or Family Pack services, if you were to go to your provider and see if they've got a relationship set up with Merck, it's a little bit of a cost to the provider. They have to pay for the vaccines out of pocket and they get reimbursed by Merck for it. But there might be a program that would be available to you if you've got a provider who's enrolled in that, where you would be able to get the vaccine paid for. So I do know it exists, but I do know a lot of places, the place where I work, you couldn't afford the out-of-pocket expense to get it, even though most people would be eligible for the reimbursement. So it's kind of a catch-22, but I do know it's out there and available.
Okay, cool. Thanks.
Yeah.
Do I remember hearing something about benefits for gay men, like reducing, I don't remember, anal cancer, throat cancer, something? Is there any evidence or anything?
I know of no study that has specifically followed gay men, unfortunately, but we know that if it's going to reduce your risk of getting these other sorts of HPV diseases, then certainly it is going to reduce those risks. I don't know for sure which strains of HPV are more associated with throat or anal cancer, but I imagine that probably there is some link to the ones that are already protected in here. So I don't imagine that it's going to hurt someone, but I also don't know of any studies that have specifically looked at gay men. If there's any area where it might end up getting looked at, it's probably through HIV research. So possible in the future that we might see something on that. But I mean, if it's going to protect against genital warts, that's probably a good enough argument for people to get that. All right. I think that does it for HPV vaccines. So we're going to move on to some more fun with HPV, which is cervical cancer or HPV screening. So specifically what we're talking about with cervical cancer, so if you happen to own a vagina and a cervix, this is going to be of interest to you. And if you do own a vagina and a cervix, you have probably heard for a really long time about something called an annual exam. So much ado is made about going in to see your provider once a year, getting an annual pap smear, etc. We're now starting to move away from that. Two of the big organizations that take care of cervical health have actually started recommending that the guidelines shift a little bit to start screening people less frequently. There's a few reasons for this. Number one, HPV infection rates are really high in females under the age of 24. So if you're between the ages of 21 and 24, about 45% of women in this age group have HPV that leads to abnormal pap smears. 25% of women under 21 also carry one of these strains. So if you're doing pap smears on these people, at least a quarter to almost a half of your people are going to come up with an abnormal result. So they're trying to be a little bit more conservative and screen people less often so they don't have to go through extra screening on top of it. One of the reasons that this age group in particular has been singled out as not getting screened as often is because in these age groups under the age of 24, HPV tends to resolve spontaneously without treatment. You do want to follow these people, and oftentimes the way that you follow them is with extra pap smears, but the majority of cases do resolve spontaneously. So if someone is under 21, the chance of her having her HPV spontaneously resolved is almost 100%. So if someone's under the age of 21, is getting abnormal pap smears and goes through the whole colposcopy and monitoring deal, chances are that's unnecessary because it was going to clear on its own. So they're trying to get providers to move away from screening women who are really young for these infections. Using the HPV test in addition to a pap can also extend the time between screening. So this was really the argument. If a woman is coming in to get a pap smear and you use an HPV test on top of it, if both of those were to come up normal, you can start moving to paps every other year or sometimes every 3 years. So if someone hasn't had an abnormal history in the past, this means they have to go see their provider less often, at least for pap smears. They're still trying to recommend that people go see their provider once a year for just a general health check, but not making the focus of that the pap smear. This has been recommended by two of the big organizations that deal with women's health. So ACOG, American College of Obstetricians and Gynecologists, and ASCCP, American Society for Colposcopy and Cervical Pathology. So these are the two big groups that really follow abnormal pap smears and cervical health, and they're the ones who have come up with this new guideline. I'm going to show you the algorithm for what it looks like on the next page. So what people used to say is, as soon as you're sexually active, you should probably get a pap smear. And then they started moving to, so as soon as you've been sexually active for 3 years is when you start getting pap smears and get them every year. So now the algorithm looks a little bit different. So if someone is 21 or under, regardless of when they started having sex, they're saying don't bother with a pap smear. Someone is in their 20s, so 21 to 29, is screened every other year. Annually, if someone is immunosuppressed or HIV positive. So HIV positive women, they still want to have annual pap smears. Sometimes they say even twice a year if you're HIV positive. So ages 21 to 29 every other year as opposed to every year. In the 30s, this starts bumping up a little bit more. So if somebody has had a history of abnormal pap smears, if they're HIV positive, immunosuppressed, or have a history of DES exposure, so this was something that was taken a long time ago to allegedly reduce the incidence of birth defects, and actually seems like it has longer lasting effects on health that are not so good. So if someone has one of those, they get screened annually still. If someone has never had one of those, if they get an HPV test and a pap smear and they're both normal and negative, they only have to go every 3 years. If someone has an HPV test that comes up positive, but the pap smear is normal, they repeat 3 consecutive negatives, so every year, if you get 3 negatives in a row, then you go to every 3 years. So instead of the annual pap smear, they're trying to get the majority of people to be tested only every other year or every 3 years. And then at ages 65 and older, they consider discontinued screening under certain recommendations. So if they've had 3 negative paps in a row, no abnormal paps in the last 10 years, HIV negative, no history of cervical cancer, not immunosuppressed, and no risk factors for acquiring STDs. They're saying consider not papping at all in that age group. So a little bit different. A lot of people just assumed as soon as you're sexually active, you get one every year. We're trying to move away from that. But at the same time, trying to encourage people to still see providers annually for other health concerns, as opposed to reducing women's health to only about a pap smear and only about cervical cancer, trying to move away from that a little bit. So this is something that a lot of people seem to be up in arms about. This came about around the same time that the recommendation for moving mammograms to age 50 came around. So a lot of folks are starting to become very concerned that the state of women's health is sort of getting the shaft with these recommendations moving to less frequently. One benefit that you might see to this is if you are trying to get in to see a healthcare provider who's really booked, if they don't see as many regular screenings, they're going to have more appointments to give to their population that are for more acute reasons like infections or actual outbreaks of STDs. So there's sort of an interesting balance here in terms of screening people who are not super high risk. This would probably work for someone who feels pretty comfortable with their status, is not super worried about abnormal paps. For people who are more worried about it, this is probably going to be something that will be difficult to get used to. Another thing to note is that people in the under 21 age group and starting to be in the 20s age group are more likely to have had the Gardasil or one of the other vaccines. So the chances are for those people, PAPs are going to be something that they would end up doing less and be less at risk for having cervical cancer. So this is a guideline that I think is going to be really hard to swallow right now, but in several years, this is probably going to look pretty reasonable. Okay. We're going to move on for some more STD fun. Talk about herpes, yay! So a figure that I found when I was researching this is the overall prevalence of herpes, both type 1 and type 2, is decreasing in our population. We used to throw out figures that said 20 to 25%, and we've started to get some slightly more firm figures on exactly how many people seem to be infected. The number of cases that we're pretty sure are out there, we think at least 50 million current cases in the US, and it pans out to be about 1 in 4 females, 1 in 8 males, and overall that makes about 1 in 5 people in the US, so roughly 20%, maybe a little bit less. One thing that this suggests is that you are more likely to contract HSV from a male partner. So it seems that it is easier for females to get it. It seems like it is probably, for the most part, males who are transmitting it. So that's something to keep in mind.